Many times I think we've had it all figured out, and with every trial the water seems to get a little bit muddy in regards to the standard of care. So obviously with the initial dose-dense regimen, we were all very excited about that improvement in overall survival that we saw in those patients. It really rivaled that which we saw in IP chemotherapy. And so I think everyone was understandably embracing of that regimen. However, the results of 252 complicated that significantly, as there was really in that trial no difference in survival between the regimens, and that has been attributed to many things, potentially the differences in cisplatin that were given as compared to the 172 regimen versus the addition of bevacizumab, which seems to historically have muddied the waters even more. So I'd say right now, for suboptimally debulked patients, I think most of us would agree that the dose-dense regimen is a good regimen, or a clinical trial, obviously, when appropriate. For patients who are not the most robust, consideration of fractionated treatments like kind of dose-dense carboplatin and Taxol, like the MITO-7 trial, is a good option. And I think for those of us with an optimally debulked patient with a good performance status, I think IP chemotherapy is still a reasonable option.